Hello, my name is Bree, and I'm doing a presentation on substance abuse disorders. Substance abuse disorders are definitely a big problem here in Portland, particularly with heroin and meth. They cause a lot of health and safety issues for our city. It affects our economy, our social dynamic, and the health of our community. The effects are very widespread. The substance abuse disorders are only just recently being thought of as a mental health disorder. There's still a lot of stigma attached to it in that people think that people with addiction choose that life, or they want to be addicted. The reclassification of it as a mental health disorder allows for better quality and more effective treatment, and hopefully removes that stigma and allows for more evidence-based research that allows us to have better treatment for substance abuse disorders. But the path to addiction often starts with prescription drugs and shows a glaring flaw in our healthcare system. It used to be that prescription pain medication was easy to get from a doctor, though that has changed in recent years. And 44% of overdoses from drugs are not prescribed to the people, so they're dying from drugs that they are not prescribed. The main risk factor for substance abuse disorders is low socioeconomic status, but it certainly affects the rich and the poor alike. Overdoses are really hard. They affect friends, family, and community. Prescription drug fraud, counterfeiting, drug diversion, which is the selling of drugs, and secondary diseases such as HIV, cardiovascular disease, and hepatitis. Those all cost money in the long run. They add to the already present strain of doctors and hospitals who sometimes see multiple overdoses in the same person in one day. Prosecution of drug-related cases costs time and money and legal fees. They fill up jails and prisons and put a strain on law enforcement to respond to drug-related calls. And it certainly causes higher crime rates, so that there's a lot of theft for people that steal things to pay for their addiction. And there's certainly a revolving door with homelessness, unemployment, and addiction, when all three of those kind of go hand in hand. In conclusion, substance abuse disorders are not just about the health of the individual. The individual certainly needs help with treatment, but it also affects our community and society as a whole. Substance abuse disorders and addiction is a widespread pandemic that spans our community and the United States and the world. The understanding that no one sets out to be addicted, and so it is a preventable disease. No one wants to be addicted to drugs and destroy their lives. It doesn't just affect the person with the substance abuse disorder, it affects our community and the people around them. And we need good public education and to be aware of the common pathways to abuse, such as prescription drugs, that people might start with prescription pain medications and then move on to other things that they find on the street. And we need to continue to recognize this as a mental illness so that it can be treated as such. And we certainly need collaboration between legislators, the healthcare system, physicians, legal authorities, and community. We all kind of play a role in the fight against this crisis that we're currently experiencing. And that is all. Thank you.